Good afternoon. Welcome to this panel session with policymakers. A very warm welcome. To be effective, policy needs to work at all different levels in society, and we're very fortunate to have with us today 4 policymakers working in different contexts and in different countries at different levels. To facilitate the discussion, I'm going to ask some very broad questions, and we're inviting comments from panel members from their own perspectives. As always, please put question into the Q&A box, and a reminder, please, to speak slowly for the interpreters so that people can catch up. Our four panel members are June Lowery-Kingston, Lina Nordquist, Allison Wellwood, and Jonathan Reid. And I'd like to start by asking each of them to introduce themselves. Perhaps, shall we start with June?
We can. Hello, my name is June Lowry. I'm speaking from Luxembourg, where I work for the European Commission. I am responsible, or I and my team are responsible for the Web Accessibility Directive and for looking at how technology impacts persons with disabilities in a more general way and policy making in that context. Thanks.
I'm just going in the order that people are on my screen. So perhaps, Lina, could you introduce yourself next?
Hello, everyone. So I'm Lina Nordquist. I'm speaking today from Uppsala, Sweden, and I'm a member of the Swedish Parliament with the main task in the Committee of Health and Social Welfare. Hello.
Hello, thanks. That's great. And Jonathan?
Hello, everyone, and good morning, afternoon, and evening. My name is Jonathan Reid, and I work for an organisation called the Health and Social Care Alliance, and I'm speaking from sunny Scotland, which is a very strange thing to say for once. I am the national coordinator of something called the See Here strategy, and I work closely with Scottish Government as well. And I am also the coordinator of the Norwegian Cognition Network in relation to congenital deafblindness, which works across the Scandinavian countries too.
Great, thanks. And Allison? Sorry, I think we don't hear you. Still not. Is there a possibility of trying to test the microphone, perhaps? Okay, we still don't hear you. Perhaps we can pick up with you as soon as if we can solve this problem. I hope we can catch up with you. It's another technical glitch. Okay, can you hear us? Can you hear us? Right. Great. Okay, good. Hope we can talk soon. But before this, in planning this event, we looked at certain questions, and I'd like to ask these as a way of facilitating the conversation. And our first question is, how are human rights and policy relevant to the issues addressed by projects like SUITCEYES and the development of technology? Could I ask Lina perhaps to start?
Oh, I think I could try to answer that question for days and days, but I'll try to keep it short. I'm thinking that human rights policies and human rights laws, they tell us not only what's important, what are the pillars of the society, who is society for? Is it for just some of us, the middle-aged, middle-functioning middle class, or is it for everyone? So without these human rights laws and policies, I'd say that no one really knows whether to prioritize projects like these, whether to implement them, whether to spend money on it. So I think it's extremely important. It's the kind of framework saying that this is a society that belongs to all of us.
Yeah. Thank you. And yes, I agree about the size of the questions. Please feel free to answer them as you wish, because I agree if they are enormous. So it's fine, just we know that there is much more that could be said. Yeah, thank you. Allison, any luck yet? Not yet, okay. Oh, wait.
Oh, you can't.
Yes, we can hear you now. Welcome, fantastic, great stuff.
Thank you.
Could you briefly say who you are, perhaps, and then we could go on to the question?
Yeah, okay, well, I'm Allison Wellwood, and I'm the Sensory Impairment Policy Manager in the Scottish Government. Through the development of our See Here strategy, we provide a framework of recommendations on which to improve services and opportunities for children and adults with sight loss, deafness and dual sensory loss. We are committed to supporting them to access the health services and social care that they need. And I lead on work that relates to that and work very closely with Jonathan Reid, who is the See Here National Coordinator.
Thanks very much. And just a reminder of the question, how are human rights and policy relevant to issues addressed by projects like SUITCEYES and the development of technology?
So what I can add or comment here is to say again that we have the BSL Act that you mentioned earlier, Sarah, and which is in place. Primarily, it requires certain authorities to develop BSL plans that outline how they will promote and raise awareness of the language. The first BSL national plan was published in 2017 and was developed with active participation of deaf and deaf-blind BSL users who worked with public bodies as part of the BSL National Advisory Group. And it contains 10 long-term goals which cover early years in education, training and work, health, mental health and well-being, transport, culture and the arts, justice and democracy. As part of that, I manage the contract for Contact Scotland BSL, which is a video relay service that enables BSL users, deaf and deaf-blind BSL users, if the deaf-blind BSL users can use Braille, to telephone essentially anybody via the interpreter, the video interpreter. So they will sign to the interpreter through video, who will then make a call to anybody at any time of the day, any day of the year, and relay a conversation between the person that they're telephoning and the BSL user. So we have that technology in place, and that has been on the go since 2016. And currently there are about 4,000 calls a month. And this has been a huge jump, as you can imagine, due to the pandemic, and has been an absolute lifeline for BSL users during this pandemic, as it has allowed them access to information and their families.
Great, thank you. Yes, as you mentioned, unfortunately in the UK we still don't have full legal recognition of sign languages, and Scotland has really led the way on that. Jonathan?
Thanks. Yeah, I mean, I think just to add to that, I mean, and on the back of what Allison was saying, that this really shows us the need, as we've mentioned before, to kind of bake in authentic lived experience into policy decisions. It needs to be absolutely central going forward. And as Allison was saying, in Scotland, the BSL Scotland Act gathered opinions and worked very closely with communities who were British Sign Language users and other groups as well in order to achieve that. When we look at deaf blindness as a topic more specifically, one of the issues that I think that we face is that the sort of homogenous nature of deaf blindness is very unique. So no two people will really experience deaf blindness in the same way. The age of onset of the condition, the visual acuity levels, the auditory acuity levels, whether the deaf blindness is cognitive and in the brain to do with APD and CVI or not. These things will all, and whether language has been established in the individual before the age of onset of the condition. All of these things will play into the communication and the ability for an individual to have agency within that process. And so we therefore then widen that to look at the competencies of the communication partners around that individual. And so I think there's some wider conversations that we can then have around how we get to a place where the competency levels of communication partners around deafblind people are able to impact and support policies which then can be rolled out in a wider sense.
Right. So, okay, thanks very much. Great, different perspectives on how what's needed in terms of human rights law. Could I ask another question, which is, what is needed to implement accessibility in practice at a country level? And I think it's only fair to ask these of kind of country level people, really. And obviously, this is another massive question. There are so much to implement accessibility, but I'm wondering if I could invite you just to mention one or two issues that you feel are important. Perhaps Lina.
Thank you. I think, of course, one thing is we need to have infrastructure for evaluating safety, integrity, infrastructure for subsidization, making sure that it's not a question of economy, whether you can afford different kinds of technology and different gadgets that help you take part in society. Things like broadband, fiber and such things. I think that we can quite easily see in almost every country in the world that there's a kind of, how should I say, there's a tendency with us politicians to say, oh, well, of course, we like inclusion, accessibility, we like equality. We will tell you when a question comes up that's related to that. And I think that we have to do it the other way around. We have to say that, what if everything is related to accessibility and inclusion? What if it's actually the person, the actual person with, in this case, deafblindness, that they should determine, is this something where I need to be involved and have an impact? So I think we need to turn things upside down. We have to create society in another way, and we need to see that it's not just a question of this particular issue. It's a question of how we create society, who's allowed to cost money, who's allowed to be involved, who's allowed to take part in things and decide what's important. Sorry, that was a very long answer, but I hope you get the point.
Yes, absolutely. And Allison? As a reminder, what you think is important at the moment for implementing accessibility in practice at country level.
Okay, can you hear me okay?
Yes.
Yes. Okay, well, I would say partnership working has been what we have found in Scotland to be essential. We have, as I mentioned earlier, the See Here strategy, and that is there to support children and adults with sensory loss throughout the country. we provide funding to all the local areas, all the local authorities who have within their local authorities a See Here lead. And that See Here lead may be an NHS worker or a third sector worker. And they have a partnership within their local authority that involves all sorts of organisations and support organisations as well. And they decide within their local area what their local priorities are. And they apply the funding that the Scottish Government provides as they see fit within their local area. And each local area may do things differently depending on the needs in their area. However, what they do is shared with each other. So Jonathan Reid on the call here is our national coordinator, and he ensures that the See Here leads come together and discuss and share information and best practice and ideas. And that is what we have found to be the most effective way of making things accessible, is to partner with others to get the lived experience from people with the lived experience, from the technology point of view, from the health point of view, from the social point of view, everybody coming together to share ideas.
So it's really, implementing accessibility is really part of an ongoing process. So we have to think about the process, not just perhaps particular policies. Yes, thank you. Good point. And a similar one made by Lina too. You're thinking on turning things over. I see I just have a quick reminder in the chat to ask us all to speak more slowly. It's very easy to speed up. I must remember that myself. Thank you. Right, and so this actually, the next question we have kind of leads on quite neatly, I think, to ask, how can people with deafblindness participate more in research and development projects or policy decisions? So this is more in projects. I mean, just as by way of a bit of background, I've been interested to see increasing participation of people with deafblindness just in the past few years in some quite large projects, and that's good to see, and not coming in as afterwards, but in there from the beginning. But I'm wondering what we can, the question is really what we can do more to do that, and or in policy decisions. I think the structures are there often, particularly at European level, but maybe less so at country level. But they're not always as effective as they might be. And I think a couple of people opted to answer this one. Perhaps Jonathan, can we start with you and then ask Lina?
Thanks, Sarah. Yeah, I mean, I think that, you know, as you say, I've detected also recently, in recent years, more deafblind people becoming involved in research. And really going back to, you know, some earlier points that many people have made. I mean, this really is the bedrock, I think, of where we're going forward, to have people situated at the heart of that, to have that authentic voice and those platforms available for people. I mean, in terms of, you know, designing the world, particularly post-pandemic or within an ongoing COVID context rather, you know, it's essential that these voices are front and center as part of the journey that we are all taking. I was chatting to a colleague the other day who was just noting that, you know, the Nordic definition for deafblindness really rests on three key areas, which are to do with communication, information, and mobility, and those three rights. And my colleague was just noting the fact that the entire world has been through a communication barrier recently. We all know what it's like not to be able to speak to people we love or go and hug somebody, all of that. And I feel certainly in Scotland at the moment, amongst the third sector and amongst Parliament, that there is a political appetite to move towards inclusivity in a greater sense, to work together in smarter ways. And when we're thinking about that and research in particular, there's three cases that I would base it on. For, you know, there's a business case for this, first of all, which just means that actually getting technology right and getting people at the heart of that will just widen the people that are able to use that technology and bring people in. There's an ethical case for it, which is simply that it is just the right thing to do. And there's a legal case for it, as we've heard already. There's already many European laws, directives that relate to inclusive practice and inclusive and accessible communication happening. So, you know, as I've said, particularly unique group, and it's an interesting group in terms of
It seems that both Sarah and Jonathan have frozen. Would anyone else like to answer the same question while we are waiting for them to come back?
I could try to say a few words while we wait for Jonathan to finish what he was actually saying. I hope I won't make a mess out of the answers by speaking in the middle. Well, I'm thinking when it comes to taking part in research, in development and implementation, that we can compare this to the development of everyday things in history, I think. That if you look at, for instance, my kitchen, a bit away from here, that kitchen was originally developed by some man, but it was to be used by a woman. So if you look at the kitchen counter, it's almost, well, still in many countries, it's the wrong height. If you look at the oven, it's put somewhere where it's hopeless to use, and it will make your back hurt. And I think that the same problem still goes sometimes for welfare technology, for pharmacy, for big parts of society, that some people develop things for other people. And what we need to do, I think, is to make sure that the people using the kitchen, the people using technology, that they're actually part of deciding what's important to develop to start with. What do we need? What do we want? And then how does it need to be designed? What are the important aspects of function? And I think that there are two very important things to consider, well, practically. One is to have a structure somehow to take in what we in Sweden call specialist people, specialist patients. Someone who's lived with themselves, as many others do, for long enough to be able to explain somehow what do I need, what do I think other people need. But secondly and lastly, what I also think we need is an infrastructure, some kind of quality registers to make sure that it's not only this specialist person, specialist patient that gets their voices heard, but also everyone, so that we actually have some way for people to report what they need, how they think that the existing aids and gadgets work, and what they miss, so that we make sure that we stop having some people developing things for other people. Thank you. I hope Jonathan's back now.
Yes, sorry, Sarah, I jumped in and we continued the conversation. Please go ahead, Jonathan, and Sarah, I hand it back to you.
Oh, thanks very much, Nazreen. That the whole thing just crashed suddenly, but good to be back. Right, where were we? I'm just trying to briefly to, yeah, we were, I think it was Jonathan that your connection broke in the middle there, and then I disappeared. So perhaps I can invite you to continue. And apologies if I get things wrong because I missed them, but over to you, Jonathan. Thank you.
Thank you, Sarah. My apologies for that. Yeah, there's a delicious irony in here somewhere, but I can't quite work it out. Yes. I don't quite know how far along I was before I was cut off. But it was absolutely wonderful what I was saying after I was cut off, I must say. I think I was talking really just about the three cases for an inclusive approach to this at a societal level, and the idea that, you know, there's a business case for developing inclusive practice, and especially in terms of technology, and especially in the context of COVID-19. That, you know, we will just engage with more people, and we will drive more people into having agency in the world. And then there's also an ethical case for this, which is simply that it's the right thing to do as a society. And finally, that there is a legal case for it already, and there is a number of legal frameworks and directives and EU laws that we can already apply to this in terms of disability and discrimination acts and so on and so forth. So for me, much of the architecture that we need to employ here already is in existence. And I think that, you know, there's certain approaches that we can look at. What conferences like this do is remind us that actually the deafblind field must be an internationalistic field. We cannot, deafblindness will not pay attention to any borders, Brexit or not. And so and the incidence levels are too small for each country to realistically direct enough money into. So we must keep an international framework at the heart of our thinking going forward. And yeah, I'll stop there.
Thanks. Oh, yes, it's unmuted. Thanks very much indeed. Absolutely. Just briefly before we go on to the next question, I would perhaps respond to Lina's question. It is a complicated one about representation and who represents, and that and it doesn't necessarily have neat, I think in our situation, have neat easy answers, but perhaps we can yeah, but all the same, that doesn't stop inclusion of people from being important. I agree. It's a bit too big to go into in the time available. So I'm not going to. I've suddenly thought, no, I won't, because it is rather large. Just a reminder to ourselves to keep the speed not too fast, I think, of the replies. Thank you. And we have one more question. I think we also may have a few comments in the chat, which we can come to afterwards. But our fourth question is about inclusion and accessibility challenges that are still to be addressed in the future. And I'd like to invite June to reply to this, and it would be great to hear some more from you, June, really, with your important perspective on this. And also, I'm aware from a slightly different perspective too, from perhaps the rest of us. So over to you.
Okay, thanks very much, Sarah. Well, really, I can only sort of support what's been said by my colleagues on the panel. And going back to what Lina said at the start, you know, this is, and the question you had about human rights laws and policies, that really is shaping how we look at this in Europe, especially under this current commission, where there is great commitment towards inclusion across all sorts of minorities. And of course, persons with disability is the one minority any of us could join at any time. So it's a minority that we really should be paying much more attention to. So in terms of what, again, it's a vast question that we could probably spend all the rest of the day discussing, but I would say the problem is not the technology. if we want to solve the problem, we can. That's a question of resources and prioritization, and what questions we ask and what questions we want to solve. And that's why, you know, delighted to have the money for a project like this, and that we've been able to support that. And I really, you know, look forward to sharing the results of this project with all my colleagues involved in equality across the Commission. But how can we make a difference in terms of tackling those challenges? And just to sort of move the conversation on a little bit, I would say, if I had a magic wand and I was allowed to do one thing that was limited and couldn't sort of bring about huge medical advances, it would be to tackle the technological community, really, that the current and the next generation of developers. And ideally, I would like to see curricula, I'd like to see training with persons with disability, really just teaching accessibility and that awareness, as we've heard, of the diverse needs of users, that just becomes standard. It's not a niche issue. It's a huge business opportunity. And as Jonathan said, you know, we know the ethical case, we know the legal case, there is a whopping big business case for this. And this is where initiatives like the Valuable 500, I think, trying to turn that round to business and say, look, there's a market here. Why don't you benefit from diversity, both in terms of consumers, but also in terms of your workforce and your attitude towards products, and make the most of that opportunity? That's something we really hope will happen with our Web Accessibility Directive. That's imposed a burden, if you like, on the public sector, saying all your websites in Europe, all your mobile applications have to be accessible, full stop. And for mobile apps, the deadline is next month. The websites should already be the case. So we want to raise awareness of persons with disabilities. You have the right to expect that to be accessible. And as we've heard, access to public information has never been more important than over the past year. But also we want to say to technology companies, there is an opportunity here, not just for accessibility, but for the development, but also in terms of monitoring and testing, and for doing that with persons with disabilities who are the users of these services. So I think I've probably spoken quite a lot, but I'll stop there, but happy to continue that or to take more questions.
Not at all. Good to hear from you. Important. Now, I've just been, I understand that we have got questions from the audience, and it's great to have questions from the audience. Unfortunately, I cannot see these questions because I was cut off, but our colleague Arthur will read me some of the questions out of the Q&A, if that's okay. Is that okay, Arthur? Could you give us one of the questions?
So
Grant,
the first question we have is, how do you deal with effective representation, conflicts of interest, and power tensions between policymakers and citizens with disabilities? Who has the final say?
Volunteer for this question?
I can try. Oh, sorry.
Yeah.
You go ahead, Jonathan. All right. Well, I'm thinking a conflict of interest, then of course, we need to have a system where someone says, excuse me, but I'm not objective here. I need to move aside. But when it comes to who has the final say, I think that it has to be the person you can fire if they make the wrong decision. So it means that the politicians, no matter what level, they need to have the final say when it comes to the sort of framework decisions, because only then can everyone else fire them if they make a mistake. Then when it comes to the execution of saying, you're entitled to assistive personnel, you're entitled to subsidize the technical aids, that has to be done, I think, in a very, very objective, not political way. So I think politicians put up the framework. If you don't like the framework, you change politicians. But as long as the framework is there, you need to have objective people making sure that the decision for David is the same as it would have been for Alicia or for Ali or whoever. Making sure it doesn't matter who you are. If you're entitled to aid or you're entitled to an impact or involvement, then you get it. I think if I understood your question correctly. Thank you.
Anyone else wish to comment on this one? Not particularly, Arthur. I do just see one comment, which perhaps I could. It's just a comment from Sanya Tarksay. Sorry, Sanya, if I got your name incorrect. Who is the president of the European Deaf-Blind Union. She said, I would like to emphasize that although many sectors do work actively on the inclusion of deaf-blind and organizations of deaf-blind, but the main problem is that many countries have a very poor and inadequate support systems, not to mention lack of interpreters and education in digital literacy. So the will is there, but the support is not. And thank you for that important comment, which echoes perhaps what some others have said. Arthur, are there another questions? Is there another question in the?
Yes. So Maria Guadalupe Alvarez Diaz asked a question to panelists. How do you foresee the journey from policy to implementation? Encouragement to apply policies are perceivable to the general public. So encouragement to apply policies are perceivable to the general public or common citizen. Could you describe possible scenarios in any of the countries, Sweden, UK, Scotland? So if I understand correctly, how do you foresee the journey from policy to implementation? Yeah, so the citizens can perceive the willingness.
Lina, I see your.
With the risk of now describing my entire home, because I just happened to talk about the kitchen, I will now talk about my garden. I think when it comes to policy and implementation, what we should not do is what I did to my garden, to my garden. We should not make sure to get loads of gardening magazines and then not go out and dig in the garden. And there is a habit of that, I'd say. I'm probably guilty of it myself. We make decisions, we get them down on paper very neatly, and then we forget that it takes very, very much knowledge, time, money. Loads of people need to understand why is this important. They need loads of knowledge in order to actually execute what we decided. So I think that sometimes we could spend a little less time on the gardening magazine and a little more of the budget and time on the actual gardening. That's my my tip of the day. Thank you.
Yes, thank you. That indicates that something for us, it would be lovely to see our hippie in action and being used in practice. Be great. Yes, Allison, please.
Yes, I would just like to reiterate what I said earlier about the See Here strategy and how the policy is there, the recommendations are there, and to make those recommendations come to life on the ground, it's the local areas, the local partnerships that decide what is needed. And within those partnerships, there's the people that need the support or the resources. There's the people that provide the resources and the support. There's all sorts of people included in those partnerships so that things do get done and there are outcomes that relate to the policy and the See Here strategy. Obviously, there's a long way to go and there's never enough money and there's never enough time to do everything. But I think that's one way forward, is to me sitting here, you know, in the Scottish Government. I can't be out there, although obviously I can't because of the pandemic. However, the experts are out there, and it's up to the people that need the support and the people that can provide the support to decide how best to get on with that job and do that job.
Okay, thank you. Arthur, are there any more questions?
Yes, there's one question. It's a long question, so I'm trying to simplify it.
Actually, Arthur, I think
Yes.
Jonathan would like to answer that question.
Oh,
as
sorry,
well.
sorry.
Oh, thank you. Yeah, no, it was really just to add on to what Allison was saying, and something that Lina had said earlier as well. And, you know, in Scotland, we do have, as Allison had mentioned, we've got this See Here strategy, which reaches out into, so each area of Scotland will have a See Here lead, who will then connect with their local sensory groups, their third sector organisations, health boards, educational establishments, and that will also pay attention to the socio-geographic nature of Scotland, which is quite disparate. We've got a central industrial area in Scotland, and we've got islands and highland areas and haggis running about the hills and all of that. So all of that comes together. I'm also thinking about the BSL plan and act, where, you know, we've recently seen this journey from policy to practice, where we worked very closely with communities, BSL users, to establish this rights-based focus as British Sign Language becoming a language in and of its own right in Scotland. Each local authority area was charged with following, I think, a 38-point plan to establish that. It's not perfect. It can be a little bit messy sometimes, but it is advancing. And again, it's a sort of cyclical process of movement to get that established, but it isn't perfect. And the last point that I'd like to make is really around another point, which is to do with health literacy. And in Scotland, we've been kind of badged as a health literate champion globally, alongside some other countries like New Zealand. And one of the metaphors that I quite often like to talk about is that there's a hospital in Scotland on the East Coast, and I won't name it, but when you walk into that hospital, there's a huge big board at the end of the corridor, and on that board, in NHS blue background with white writing, is signposts to every single department in the hospital, from oncology right through to everything else. And one of those little signs is written in yellow writing on a black background, which is much easier to read, of course, if you have sight loss. And that little department is for ophthalmology. So that tells us that the only reason you might visit a hospital is if you have a sight loss, is to go to ophthalmology. You'll never get pregnant or visit your grandma or anything like that. Now, strictly speaking, we have ticked the box there, right? Somebody has gone, hey, that's a great idea. Let's put that in yellow and black because that'll be good for people with sight loss. And actually what we should have done is put the whole board in yellow and black, and that would have been great for everyone. So as a kind of metaphor of where we are, I think the tide is turning, but we're not there yet.
Thank you very much indeed. Time has flown really fast, and I see we're approaching pretty much the end of the session. Thank you so much to everybody on the panel. It's been great to establish contact with you, and there's so much more we could say, but perhaps we can follow it up afterwards. And I hope that there will be opportunities to do it. Thank you so much for your complementary and diverse perspectives, which we've touched on, you know, what's important to do, what's important in the actual doing of it, how we can put it into practice, the complexities and vagaries of that. And we look forward to continuing the conversation if we have a chance to do that And thank you very much indeed to all of our panelists. Thank you.
Thank you.
Thank you. Been a pleasure. Bye-bye.
Thank
you,
you.
everyone.
Bye.
Thank you. Bye-bye. Bye-bye.
We will start again in 3/4 of an hour. And if panelists can stay on, of course, in 1/4 of an hour, with a panel with the country researchers for the work that we did for Suitcase after the break. Thanks very much.